Welcome to the Lead Change podcast. I'm your host, Dr. Mary Mulcahey. I'm an orthopedic sports medicine surgeon with a huge interest in contributing to the growth and development of other leaders. On this podcast, we will share stories from many leaders in all medical specialties to understand the skills necessary to be an effective leader. We'll celebrate their success and hear about strategies to overcome hurdles. We will also highlight some of the unique challenges faced by women in medicine who are interested in pursuing leadership positions and the importance of mentorship, sponsorship, and allyship in achieving and being successful in those roles. Let's work together, build on shared experiences, learn from those before us, and use these lessons to propel us forward in our career. Let's lead change. Welcome, everyone, to the Lead Change podcast. We have a special live episode from the Executive Leadership and Academic Medicine program in Philadelphia. I'm so happy to have Dr. Leon McCrea on the podcast today. Dr. McCrea serves as the Deborah J. Tuttle, MD, and John P. Piper, MD, Vice Dean for Educational Affairs at Drexel University College of Medicine. He's a dedicated leader in medical education, and he is recognized for his efforts to advance inclusive excellence in academic medicine. Dr. McCrea is an associate professor in the Department of Family, Community, and Preventive Medicine and has served in multiple leadership roles, including as the program director for the Family Medicine Residency and the Drexel Pathway to Medical School programs. In these roles, he focused on developing competency-based curricula and fostering mentorship to advance the next generation of healthcare leaders. Dr. McCrea completed his MD and Master of Public Health degrees at the University of Pittsburgh. He trained in family medicine at Crozer Keystone Health System. Additionally, he proudly serves as the chair of the consortium of Dedicated Health Education, a regional collective dedicated to advancing inclusive excellence within health professions education. Outside of his professional achievements, Dr. McCrea and his wife, Nikki, recently celebrated 18 years of marriage. He's a proud girl dad to their 2 teenage daughters. Balancing his personal and professional commitments, Dr. McCrea remains an exemplar of organizational innovation in medical education, preparing learners and faculty to lead in the evolving healthcare landscape. Leon and I first met in September 2025 during the first in-person week of ELAM. It has been great to participate in this program together. We're learning so much, and I'm excited to talk in detail with Leon now about some of his leadership roles and the insight he has gained throughout his career. Leon, thank you so much for being on the podcast. Welcome.
Oh, thank you so much. That was like a mouthful of an introduction. You know, when people say something about you, it kind of makes you blush a little bit. So, but I appreciate those kind words.
Thank you so much. I'm excited to have you here. I appreciate your time. So before we really dive into some of the leadership focused stuff, I wonder if you can tell us a little bit about your clinical practice and highlight some areas of expertise and interest.
Absolutely. So I am a family doctor by training and proud very specifically about what I call being a generalist, kind of taking care of individuals from literally the womb to the tomb. In my journey as a family doc, I've practiced delivering babies. I've done ICU care. Now my primary practice is, kind of general outpatient family medicine where I take care of, again, people of all ages. And I think the exciting thing is that having done all those parts of practice, when you start to take care of generations of people. So I have kids that I've delivered who are now adults, and that has been just a wonderful thing to see that growth. Also excited to continue to be an educator of residents, which is really, really important to me because I think teaching others how to take care of people is really important. I think there's an art to doctoring that is more than just understanding clinical diagnoses, but the ability to help other people understand their healthcare options and how to make high quality decisions is really important. And actually meeting people where they are, because the reality is that it is not necessarily my health goal, but the patient's health goal that is most important. And so I think that is kind of how I approach my practice now. Again, outpatient procedures, community-based engagement. Obviously, any family doctor does diabetes, hyperlipidemia, hypertension. Those are kind of my bread and butter. But yeah, I will, to the best of my ability, hope to always do some version of clinical care.
That's fantastic. And I think family medicine is one of the unique specialties in that you really do. You work with patients of all ages and you follow them and work with them, take care of them really throughout their lives. And then you're taking care of their kids and, so that's a really unique setup, and you get to take care of so many different types of things and delivering babies too. And taking care of long-term kind of health-related conditions. And I love sort of the teaching aspect, right? I'm also in academic medicine, but I think that opportunity to work with residents and medical students and to help them, teach them how to take care of patients. And I think the point you made about the art of medicine, like that is really, really, really important, that it is an art. And so we learn and we're constantly growing and developing and learning things and adding to our skill set and trying to impart some of that onto our residents and students is something I know clearly you take a lot of pride in.
No, I think we both do. I think that, the ability to take care of other humans is a gift that like we should not take for granted. And I think it's our responsibility. I think the greatest impact any of us can have is to teach others to do it as well as they can do it.
It's a privilege. It's a huge privilege.
Absolutely.
Absolutely. And we think about that every single day.
Absolutely.
So you currently serve as the chair of the consortium of dedicated healthcare educators. So congratulations.
So the consortium dedicated to health equity education really started as a regional collaborative of deans dedicated to diversity, equity, and inclusion. And that work has obviously evolved in terms of our ability to make an important impact to actually address health equity. Because at the end of the day, the reason why we want to make sure we have a broad swath of humans who take care of people is so that we can actually decrease health disparities. We want health outcomes to be the same for individuals, no matter where they were born, what their zip code is, what their racial or ethnic demographics are, whatever those things. We want to make sure that those components are addressed. And so then what is our responsibility? Our responsibility is to hopefully create a workforce that is as inclusive as possible, because we know that if there is concordance between patient and provider, and however you define concordance, that's again, shared language, shared lived experience, maybe also bald-headed like me, whatever the thing is that where you have concordance, it actually does impact positively in terms of health outcomes. So then what happened was all of us regional deans, we got together and we said, how do we get out of the competition business and get into the collaboration business? Because when you're looking for the same talented subsets of individuals, and I live in the city of Philadelphia, where there are a myriad of medical schools, we were all looking for the same small subset of really talented individuals that were mission aligned. And so then we said, well, like, you're looking for these students, we're all interviewing the same folks. How do we actually increase our funnel? How do we increase the availability of individuals who would go and do this work? And so we started with simple email. It was like, hey, friends, like, you want to get together? And you know how it is when people respond to email. Some did, some didn't, but we stayed at it. And we eventually decided that it was worthwhile for us to meet. And that meeting started an affiliation, started the development of an actual consortium where we actually build programming now. So each year we have a summit where we address issues related to health equity, whether that's starting at the beginning of the pathway, which is helping folks get into the medical education space, or how do we handle the environment once folks get into our medical ecosystem, or readiness for the next phase. So like right now, our next conference is going to really be about transitioning from UME to GME, and how do we get folks ready for that phase. The other piece is, so we do this equity summit. The other piece though is that we are really intentional about how do we increase the number of individuals who get into this space. And so the way you do that, as we recognize, is we have to go earlier in the pathway. And so we targeted local schools, again, local to the Philadelphia area, that were under-resourced. And I'm putting under-resourced in air quotes because I'm not attacking any of these places or schools or whatever, but they did not necessarily have the same availability of resources as we had in order to actually provide support and direction to go into medical fields. So we started a pathway program, and that pathway program has been supported by Robert Wood Johnson Foundation, but supported by Independence Blue Cross and supported by the NBME. So we have all these entities that have come together to support this consortium and help us not only put on equity summits, but also develop an intentional pathway program that we were really proud about. We've had our second cohort of students. We are getting those students ready to take their MCATs and get ready for preparation. We've learned so much. We've developed incredible partnerships with these local schools. And our hope is that this CDHE will really become an institute for education going forward. So really excited about the work.
Wow, like I am so impressed, and we could definitely spend the rest of the time just talking about that. I would love to unpack every bit of it, but just trying to pull out a couple things. I mean, first, like, really congratulations. That's so impressive, and what a major impact I'm sure that is having.
Yes.
Like, just the priorities, the initiatives, and some of the key points that I just wanted to highlight too is, like, as you mentioned, right, the importance of developing a workforce,
Yes.
also that representative of the patients that we are taking care
Yep.
of. Right? That is absolutely critical. And that is for medicine as a whole, right? That is not just family medicine. Like, we also, even in ortho, have those same
Yes.
priorities, right? Are recognizing gender, racial, ethnic diversity of our, medical students, residents as we move into practice. And on the, related is from the patient side is also recognizing that there are differences in our patients based on their backgrounds too,
Absolutely.
males versus females, or racial differences in their risks of certain diseases, their outcomes. And so huge priorities in medicine as a whole. So it's really incredible to hear about the things that you guys are doing.
And can I add one thing, just as we're doing it now? I just think that is the genesis of the group. But I think the other piece, because this is a podcast about leadership, is how do we get those people together? And I think it's one thing to have this notion of something you want to accomplish, but how do you get people who are incredibly busy, who are obviously dedicated to their work, to give extra time? So I think part of it is, can you align around a common goal? Can you find something that makes, as they say, people would do for free? And with that, though, still the willingness to sometimes not accept the first no. Because as all of us know who are leading in medicine, you get requests all the time for your time. Can you join this committee? Can you be involved in this? And it was really getting to the why. It was getting to the, like, we are stronger together. It was getting to the notion of, like, I need you in this. And so the thing that my responsibility has been in the chair of the group has really been about galvanizing people to share around a common mission, and really interpersonal relationship and relationship building and connection has been really the key to, I think, what my leadership responsibility has been with the group.
Yeah, that's amazing. I think a really critical point. I love how you put all of that together, is that it really is. It's the why, it's the mission, it's the central purpose and goal of that group that you are uniting everyone around, right? And that you're recruiting people to be part of it who share similar goals. Yep. And so that really speaks to the ability of that mission and the goals of the consortium to really be successful.
Absolutely.
So that I think is critical for any type of leader in any role, whether you have an official title or not.
Yep.
But centering around a common goal, right, really just elevates everyone, unites them in sort of a common mission and moving things forward.
Absolutely.
So you also currently serve as Vice Dean for Educational Affairs.
Yes.
So what does that role entail, and what were some of your goals as you stepped into that position?
Yeah, absolutely. So I always say that there's a job you think you are going to do, and then the job you actually do. So I think my official title as Vice Dean for Education, of course, is to oversee the entire educational mission of the medical school. So that means admission, student affairs, curriculum, assessment, and evaluation. And so those are key components. And it is obviously understanding all of those components, but also making sure that all those areas have the resources they need, that we problem solve when appropriate, that we have to determine mission and vision for each of those components. And also to make sure that there's a programmatic direction, because I think that, making sure that folks are inspired, even in a resource scarce space, on how it is they're going to accomplish their goals is probably the most important thing that I can do. I think the other thing that happens once you get into the space as a leader, though, is that you recognize, like, oh my gosh, we have problems. And oh my gosh, we have opportunities, though. And so I think the thing that's really interesting is, how do you get folks to recognize that even though we don't have the resources we want, and even though there are a lot of problems, that we still are responsible to innovate? Because so many times when resources are scarce, all we do is what we think is essential. And so it means we're not growing. And so one of the threads that I think has been my most important responsibility is to say, we still have to innovate. We can't keep doing the same curriculum. We can't keep just teaching it the same way. And I got to get more out of you, even though you feel like you don't have more to give. And so it's a lot of pleases, thank yous, appreciation in lots of ways. There's even more relationship building that I think you recognize when you step into this space. And I think, like, what I always say is that in leadership, I always say that the closer you get to the top or to the sun, it isn't just brighter, it's hotter. And so a recognition of that, there are so many more things to consider as you get to understand just more breadth and depth of your organization and how you navigate that. And so that has been actually my joy in this, is partnership with my dean, partnership with all of the associate deans I work with, to really do that push-pull to make it work. It isn't easy. I think that many of our jobs as deans are really to be servant leaders. So it means a lot of the stuff you do is going to be underappreciated, not unappreciated, because I think people recognize it, but you may feel underappreciated. And also to recognize your job is sometimes to take some of those arrows that we've learned about and recognize those arrows aren't personal, but it is an opportunity for people to actually be able to really help us think through where the opportunities are.
So much in there. I think key points, just the breadth of what sort of falls under that role, and that oftentimes stepping into a role, you may not understand the true extent of it, but then you just sort of embrace it, right? You're in this and looking at challenges and opportunities, but really focusing on the opportunities. And I love how you shift that too, right? Many of us are in a situation where, we may not have all of the resources that would make it easy to do something, but with the challenge, you can see an opportunity. And so I love that that is the focus, and it's a good shift. And you highlighted just another really critical point about relationships and relationship building. And I think that's critical in all aspects of medicine and in leadership. Though having strong relationships and having that personal connection with the people you work directly with, but also all sort of everybody involved, again, makes it so everyone is kind of all on board and sharing that collective mission.
Yeah, and that notion of relationships, I think, happens both inside and outside your institution. And I say that because a lot of times your peers you will find in other places, but also the relationships you build along the way are incredibly important because you never know what relationship you established 5 years ago, 10 years ago, whatever is going to come back and be beneficial. So, as a vice dean of education, sometimes I might be trying to establish a clinical campus for us at a site somewhere across the state of Pennsylvania or New Jersey. But as a family doc, I had a really good relationship with the other program director there, who now has become their DIO. And now I can just get on the phone and say, hey, friend, remember when we were in the wars and we were doing program director stuff together and figuring out that resident stuff? I need your help. And it's a call that now isn't ignored. And it's like, well, since we've been in relationship, let's figure out a solution instead of I'm too busy for that. And so I think that relationship maintenance is such a key component of leadership, and not the expectation that you have to talk to the person and text message 3 times a week, but just the willingness to pick up the phone and say I remember you, I appreciate you, let's talk and see how we can actually be mutually beneficial to one another is just a key component to this work.
Absolutely critical. And I love that you brought that up. Like, it's not only the relationships within your institution, the people you're working with day to day, but those outside and of your institution and people you've met along the way in various aspects of your life and career, and how those can be beneficial and helpful for everyone involved. Not looking at it as to accomplish something, but just to help further everybody's mission and benefit the greater good.
Absolutely.
The key part is there that relationships are absolutely central and paramount to
Absolutely.
everything that we are doing. So we talked about this a little bit with regards to the consortium in terms of the mission and the why, but I wonder for you personally, Leon, what is your purpose and your motivation, right? What drives you in all that you do?
Right. It's a great question. I take significant pride in the fact that in this journey, no matter the job, my personal mission hasn't changed. And it is to create more opportunities for people who look like me to have access to medicine. Look like me has evolved. So it isn't just like Black males who are bald. It is, individuals who may have unique identity, shared identity, carry intersectionality, lived in urban environments or rural environments, whatever it is, but it is creating that space. And in each of my professional opportunities, it has been about creating intentional space for those individuals to flourish. So, when I was a residency program director, I was a job creator. So I got to take a look at what the face of my residency program was going to be. When I ran a post-bac program that allowed folks to get into our medical school, it was very mission driven so that we would create a space for individuals who otherwise might not get access to medical school to get access to medical school. Now, as a vice dean for education, oh my gosh, I am responsible for the educational content for the largest private MD granting institution in the country, which is just amazing, right? I've got over 1,200 students in my medical school. And I get to actually be the one who actually creates the mission, the vision, and the values by which these students are going to learn for not just the 4 years they're there, but really to put them on a path to success. And so that all still drives back to my responsibility and my mission and my vision is to create space and opportunity for those that look like me and whatever that is defined to actually get to their destination. And so that's what keeps me going.
Yeah, that's incredible. And we can see that even in just the roles we talked about, your experience, that really what you are doing is clearly tied and driven by your main motivation, your why.
Yeah,
I love
absolutely.
That. So we mentioned also in the introduction that you are currently participating in ELAM. That's how we met. We're here now, live.
Absolutely.
So in the past, ELAM has typically been geared towards women in medicine and science. You're one of the first men to participate in this program. I think we're all so excited to have you here and have the perspective that you bring.
Absolutely. So first, I'm going to say that being, one of the first men or the first man of ELAM, I think carries great responsibility. And I take it very, very seriously. I think it is a privilege and an honor to be able to be part of one of the most significant leadership development programs in the country, regardless of gender identity, regardless of whatever. The leadership training that happens here is literally second to none. I think there's a secondary responsibility, though, and a uniqueness of the opportunity to be able to learn with and around folks who share common identity. And then what is my opportunity to bring something unique to that space? I laugh because I'm a girl dad. I have a girl dog. I have a wife and a mom, and we all live in the same household. I used to teach high school at the Philadelphia High School for Girls. I think my job here has been to absorb as much as I can and really learn from these incredible humans I'm collaborating with, to be present but not be disruptive, which is, I think, its own unique responsibility, but also just to find joy. Like, I want to be a better leader too, right? Like, I think the other part about this is that, like, the joy of the work is I'm going to take these skills and my organization is going to be better. I'm going to be a better leader, and it's going to position me for whatever is next. I can tell you this. I did not wake up planning ever to be a vice dean of education in my medical school that I work at. I also didn't wake up and say my plan was to be the first man in ELAM. But those are things that have happened, and now those things will propel me to whatever is next. ELAM has also given an opportunity for us to develop things like around allyship and what that means. And so the ability for us to work to change not just individuals, but change systems. And yet in learning allyship, on the individual level, there are these personal things that I need to think about in my own walk. And am I being a good ally to my wife, to my daughters, to my mom, to my colleagues, and whatever their identities are? And are we being good allies to each other? And so an ability to work through that and actually develop that educational content with ELAM is going to be a lot of fun too.
Yeah, fantastic. Fantastic. Like, I love all of the points that you touched on, and you bring a really unique perspective. And I think you emphasize the key point, right? You want to be a better leader.
Yes.
You want to continue to grow. You want to learn, and bringing those skills back. And a really important aspect too is that of allyship, and the specific ELAM allyship. Definitely, I want to ask about that in more detail. But just being an ally is absolutely critical. I mean, in orthopedics, right? Only 7% of practicing orthopedic surgeons are women, right? So 93% are men. And so having allies too within orthopedics, within all of medicine, is really critical to help advance the field, to move all of our missions forward, to support the growth of having, physicians who represent the patients we take care of. So I love that aspect, and I'm so glad that you brought that point up.
Absolutely.
And then for the allyship track for them, can you just share a little bit? This is the first year that program has existed, so you've helped direct and run that.
Yeah, so it started as a pilot program really to create a space where individuals can learn about personal mediated allyship in terms of how you can actually be a better ally as an individual, to take that to the professional realm in terms of how you can create better opportunities and better ecosystems around which you engage in work, and then how we start to learn to change systems. We had an incredible pilot, 20 individuals. They came through 3 one-day sessions that started in January, finished in September. Just incredible work that was done, incredible collaboration. We worked with David Smith and Brad Johnson, who wrote a book called The Good Guys, where they really talk about the importance of gender-based allyship and how men should be better allies. How is there a responsibility to be better allies? But I'm going to make the argument that allyship needs to happen by everybody for everybody. And the notion is that if we make all of our inclusive environments better, it's better for everybody. It's better for me as a man if our environment is more inclusive. It's better for everybody. And so the notion of us making systems better helps everybody. It's that notion of like all ships rise. And so I think that, our charge should really be not just about this notion of the tension around, men versus women or what those things are, but really about how do we make systems better. I mean, you mentioned it in your discipline, the amount of assumptions or lack thereof, or opportunities or lack thereof, or situations that are created or not created based on how you are perceived. And sometimes the hard part is you don't necessarily know. And the thing that's so hard when you carry intersection is, am I not getting the opportunity because I am not qualified? Am I not getting the opportunity because there's a component of my identity that is somehow creating challenge? And so the key to allyship is really that we have advocates who are working intentionally to make sure that the playing field is as level as possible, and that we are creating some degree, and I always say some degree of equity, because the work never stops.
Yeah. Key point, and I think that's so well said. And I love that it's like focusing on the system, and that everyone benefits by being allies, by working together. And that we're not focusing on specific groups or whatnot. And so it's really incredible. And I saw the success of that program. I heard about some specific examples from you in the fall. So
absolutely,
we all really look forward to seeing how that grows.
No, we are thrilled. Like, I'm so excited to see this long-term become a pillar program of ELAM and not just be a pilot. I think that there's a lot of work that needs to be done. And even the interpersonal allyship, like how do women leaders become better allies for women? Which is also another thing that we have to think through, right? Because I think there sometimes are these assumptions that we all need allies and we all need sponsors.
I agree with that completely. And we can all be and need to be allies for each other.
Absolutely.
I want to round this out with 3 questions.
Oh, yeah. I love questions.
To ask everyone.
Yeah.
So starting with, the name of this podcast is Lead Change.
Sure.
So what does that mean to you?
So I think that a change is constant. And so I love the idea of lead change because you cannot be an effective leader if you're not willing to adapt to the environments in which you live. Rigidity is going to be your biggest enemy. And so when I hear leading change, I think it is how do you adapt and how do you embrace the nature of environment that is around you? And how do you then continue to inspire the people around you to recognize that that change is constant?
Yeah, critical, right? Change is constant. Change is going to happen.
Yep.
So it's just us being prepared, being adaptable. That's a key point that you brought up, being flexible and agile and being able to work with that. And getting back to a point we made earlier in the podcast is seeing the opportunity in the challenge or the change.
Love it.
Have you read any leadership books?
Oh my gosh. So there are 3 books that come to mind, and I'll mention them really quickly. Crucial Conversations, I think, is just like the leadership handbook and you have to keep going back to it. You know how there's that book that like gets dog-eared? I actually have a copy of my phone now so that, before a big conversation, sometimes you have to like reroute yourself and what those key principles are in terms of conversation. From the same author or group of authors is Influencer. And just a great book on really how do we actually work to organize change. I think it has been really transformational for me. And again, more textbook and workbook than it is just a book that you read once and put on the shelf. And then my other book that I talk about a lot is When, W-H-E-N. And this is really an important book about, it isn't just important what the ask is, but when you ask it. Are you hitting your key dean or leader or CEO at a time when they are most receptive to embrace what the change is? Are you recognizing what the climate is before you try to start an initiative? So many times an initiative isn't successful or fail because it's good or bad. It is that our timing isn't good. And so I think that as key leaders, it's also important for us to understand that when, W-H-E-N, so you can get your W-I-N.
Yeah, exactly. Fantastic. I love that. I love those books. I mean, certainly I've heard of Crucial Conversations. I had not heard of the other 2. And so certainly those are getting added to the list. I hope everybody listening is keeping, updating your list of leadership books to read. But just that point you made about when you are asking for things, when you are approaching leaders, when you're maybe trying to negotiate for something, right, has a huge impact on the success, the ability to move forward. And so that really is critical to keep in mind.
Absolutely.
Having these discussions. So Leon, thank you so much for being on the podcast. I forgot to ask you, I am curious, do you have a favorite quote?
Quotes. Oh, you know what? A couple. So, you never just get one with me. All right. So global life principle, to whom much is given, much is required. Biblical verse. I think rooted in, I have been blessed to have these opportunities to go to medical school, to take care of patients, to be a medical school dean. All those are blessings. So my responsibility is hopefully to give that back. And so that sometimes means I got to work harder, do more. Trust but verify. And that's key clinically. And a lot of times that's key administratively. That even though we have these teams who do incredible things, we have to make sure that we follow in. And then my last is one that I got from a colleague, Stacy Potts and Raj Willifer, who are family docs, which is the notion of finding freedom in your work, not freedom from your work. And so it is this notion that if all you can do is just not wait until your day is done, then you're doing the wrong thing. Most of our living hours are spent in our job. And so if you are not finding purpose and happiness and drive in that space, that means most of your lived existence is miserable. And who wants to be there? So I think our job as leaders is to not only find that freedom in our work for ourselves, but also to inspire that freedom in our work for all the people that we work with. And so like that, I think is really a fun leadership challenge for us to consistently live in, which is finding freedom in the work.
That's incredible. I've never heard anyone say that or put it like that, but you are absolutely right. And that's really, I think, a profound thought, very insightful and really empowering. I think something for all of us to think about, right? You should absolutely find that purpose and motivation and really enjoy and be passionate about what you're doing.
Absolutely.
Absolutely critical. So, Leon, this has been tremendous. I could sit here and talk to you for at least 2
Same,
hours.
right? Samesies, right? Nah, this has been a blast.
I have really, really enjoyed our conversation. I appreciate you sharing your insight and some of the many valuable leadership lessons you have learned throughout your career. Thank you for all that you do to promote inclusive excellence in medicine. I look forward to continuing to work with you throughout the ELAM program, and just huge thanks for being here.
No, listen, most humble appreciation, and love to do a part 2 at some point in the future. Take care.
I'm going to hold you to that. I'm inviting you back. Thank you, Leon.
Have a good one.